So we're talking about selfies, apps, mobile devices. Is one in your hand right now? Or I bet it's nearby. Take a look. How are you holding it? How do you hold it? Handheld devices are a huge part of our lives, but many of us are getting things like text-to-neck and iPosture. Neither one's good. Dr. Nancy Craven is a physical therapist at UConn Health. She's joining me this morning. Good morning to you.
Good morning.
Hadn't heard these terms, but boy, it sure makes sense. You know, you look at a group of really anyone, and like the group 8 to 18, I know is a big focus, and everyone's like this, head right in their lap, hunched over. I mean, none of that can be good.
Right. And yes, and we're using these devices more and more, and the concern is that our younger folks are using them more. Kids from 8 to 18 are using them, and they're in this slumped over posture. Their head's forward, the rounded shoulder, their rounded back, and then their lower back gets a lot of pressure because they're sitting there in this posture for a long period of time. The concern is these children are still developing. Their muscles and their bones and their ligaments are still developing. It puts a lot of stress on those areas, and the concern is that when they become young adults, maybe they'll develop more chronic neck pain, back pain, as well as some arthritic changes because of the stress in the tissues.
So it's actually really serious. I mean, you know, we talk about text them and that sort of thing. Maybe that's less serious than having eventually chronic arthritis issues. These kids, the younger ones, were born into this behavior. We started doing this much later, so therefore our effects are obviously going to be more minimized. So we really do have to worry about these kids who are going to be doing this for years and years and years. It is kind of dire consequences. How do you communicate that to them? Because they barely listen anyway, let alone sit up when you're texting.
Yes, it is difficult to communicate to the kids. And one of the issues is they've done a study in the United Kingdom where young adults are already experiencing more back pain and had more days off work than their adult parents of the same age group. So we're already seeing that. And so we do want to communicate to these kids how to have better posture, and we have some tips for them.
Yeah, let's go through those tips. Let's give them some help.
Okay, so one of the things you can have them do is make sure that they sit upright and they look at the device that they're using. So bring it up to eye level, so that they can look directly at it. Another thing is make sure that they're sitting back in their seat. They're not slumping forward like we see all of our kids do.
Yes, all the time.
Slumping forward, using their devices.
I'm changing my posture as we speak. Guilty of all of them. Okay, and you say use both hands?
Use both hands because there is a stress down through the arm and the neck and where the nerves come down through that area, and also through the wrist. And we've had some people have tingling in their hands from using the device in one hand, trying to text with one hand.
Okay. I need to relearn how to text then, because I'm a one-finger texter.
Right.
Hold it in one, text in the other, but I'm setting myself up for issues.
Yeah.
Okay.
And then,
what are some others?
Yes, we want to make sure that they're setting a timer. So if you set a timer every 15 minutes so that you have to move, that way you have to change that position. Now you can set this on your cell phone, so it vibrates, so that you're not bothering people around you. But you want to move at least every 15 minutes. Get up, get a drink of water, go talk to a friend, do whatever you need to, but get out of that posture.
And maybe even put it down and go outside and have fun. There's also that.
Yes.
Great tips. I think it's a reminder for all of us again. You know, I think when we talk about it, we correct, but we go right back down to that position. So really good reminder. Thanks so much for coming in.
Yes, thank you.